work session for the.
Go ahead, Chair.
Yeah, I got, just a second, I got something in here. Yeah, this is June 7th, 2021. I'm going to call the work session to order for the Hood River County Board of Commissioners. First up on our agenda, I met with Beatrice Lynch and Sheriff English of the Safe Space Children's Advocacy Center, and they gave me quite the presentation. I thought it was very valuable, and I thought it was very, very important. And so I asked Beatrice to come in today and give it to the whole board. And so thank you for coming, Beatrice.
Oh, thank you for inviting me. Good afternoon, everybody. And yes, I met with Mike Oates a couple weeks ago, and yeah, he was kind enough to give me some of his time and to let me talk to him about the project that we've got planned, I guess, for our advocacy center. Do you want me to just kind of keep going and do my presentation?
Yeah, go ahead.
Okay, I've got a really short video that we put together. I don't know, some of you probably know us before as Columbia Gorge Children's Advocacy Center. We've been in the Gorge or in Hood River since 2009. This past year, the year of the pandemic, we kind of went through this rebranding and upgrading of our logo. And we actually changed our name because in that process, we figured out that even though we'd been in the community for about 10 years, not a lot of people knew us, especially people that should know that we were here, like the medical community, the medical clinics in the areas that we serve, had no idea still who we are. Which is good. That meant that nobody had to use our center, but at the same time, a lot of people still don't know the work that we're doing here. So we did a whole rebranding, and we came up with Safe Space Children's Advocacy Center of the Gorge. Safe Space, hopefully that will stick in people's minds. We also did a video to kind of promote our new name. So I'm going to show that to you. It's only 4 minutes long, and then I'll talk about the rest of the campaign that we're doing. So I'm going to see if I can do this real quick. Are you guys able to see that my screen yet?
I think so. we're seeing something, but it's the line item that has Safe Space Final Cut on it.
Oh, okay. Hold on just a second. Are you seeing the film at all?
No.
No.
Okay, I'm going to stop for a minute then.
Was so proud of her, and I'm proud to be continuing that also.
Okay.
Child abuse is something that's not fun to talk about.
Well,
And it's kind of
just a second. This is so much fun.
It's terrible. Sometimes you just have to bring it up. This is the reality. This is the need. When I started, we did not have a children's advocacy center in this region. The closest was either been
There you
school.
go. Okay, and then I'm going to go here.
Open it from the bottom. My mom raised me to wanting to take care of people and be a caregiver. She was very much that way. And I feel like
Okay, let me see if I can do this again.
my mom raised me to always.
I am so sorry, you guys. I'm trying to figure this out.
To be a caregiver. She was very much that way. And I feel like she left me that legacy.
I
And
can
I'm
see it.
so proud of her, and I'm proud to be continuing.
Is it embedded in PowerPoint, or is it a separate, is it a Windows media file?
Not fun to talk
It's kind of its own thing.
about.
So when you share the screen, does it ask you which window you want to share?
Oh, let me see if I can do that.
So start it playing, then do share screen, and it should ask you which window you want to share.
Okay, let me go back and find it. Oh my gosh, this is so embarrassing. I thought I had it all worked out.
You are certainly not the first person to have this problem. Don't be embarrassed.
Okay, let me pull it up. Okay, let's see, share. Is it right? Is it right click or just
Well,
share?
it's already sharing. So,
Okay.
so what I'm saying is start the video, and then when you say share, select that window that the video is already playing in. To
Okay,
share.
okay. So let me see if I can do that.
And the alternative is to email it to Heidi, and she can play it on her screen.
Okay.
And be a caregiver. She was very much.
It's not coming up in my share video. So what, Heidi, can you share it?
Was so proud of her. And
I can make an attempt at that, yes.
Okay. If you could do that, I can share the other. I can share the presentation, and we can watch the video afterwards. Goodness. Well, I am so sorry. This has totally taken me off my game. In the meantime, how much do you guys know about child abuse in our area? Little bit?
I know precisely what you told me when I met with you in January. That's it.
Okay. I'm going to share this. Are you guys able to see the blue screen now?
Yep.
Okay.
Yes.
So we've in our rebranding and our update of our logos, we've decided that we were going to go launch a capital campaign to find us a permanent home. Like I said, we've been open in Hood River since 2009. We used to be in the complex that Helping Hands owns, that quad down on Wasco Street. We occupied the bottom floor of that for the first 7 years. In 2017, we moved up to Woods Court, and we've added a couple of, or actually 3 more counties that we're serving. Let's see, here it is. So we serve Hood River, Wasco, Gillum, Wheeler, and we have a contract with Klickitat County. We are the Child Abuse Assessment Center for this area. We're the frontline responders when it comes to child abuse, and that was never more evident than last year when a lot of businesses were being closed, a lot of even medical offices were being closed. We were considered essential workers because DHS and law enforcement were still responding to child abuse allegations. During the pandemic, we saw a couple of months where our numbers fell, like calls to the hotline, the Oregon Child Abuse Hotline went down 70%. And the only thing that changed during that time was that kids were at home and not in front of mandatory reporters that would call it in. The severity of cases that went on were a lot more severe, actually, because before, when teachers were seeing the kids with a bruise on their face or something, they were calling it in. Now, during the pandemic, they weren't getting those calls from the schools. They were getting calls from the ER with much more severe physical abuse, broken bones, and that kind of thing. We didn't see that much of that in our area, but I did hear of that in the Portland metro area and the I-5 corridor from my colleagues out there. So again, we work with DHS and law enforcement to do child abuse assessments. We really strive so that the healing begins when kids come through our doors. We want kids to grow up and not be defined by the abuse that they have suffered. 1 in 7 children throughout the United States will suffer some form of child abuse before the age of 18. In our area, given the counties that we serve and the demographics of children under the age of 18, we figured about 1,500 children a year will suffer some form of child abuse. I'm going through these a little fast because I know I don't have a lot of time. So if you have any questions, please stop me and I can answer these. I can answer your questions. Investing in Safe Space Capital campaign and what that means. It will ensure that we have a permanent home in this area to serve children. Right now we rent space, and the building that we're in just recently sold. So we're not being kicked out or anything, but that's still a little bit unstable for us. We will also create a Safe Space Hope Fund, and that will allow us to expand the services. So right now we work with a couple of medical providers, but they're contracted, they're not staff. And the same thing for some of our forensic interviewers. They're contracted and not staff. And what that means is that we do have a bit of a wait time. When I get a call to set up an assessment, I need to figure out who's available, which one of our doctors is available to come in and do the exam. If I can't get a hold of them, sometimes it takes, a day or two because our doctors have other obligations that they work with. So, okay. Currently we have about 1,350 square feet, and we've outgrown that. In order to right size our center for the population that we're serving, we will need at least 4,000 square feet. And then the additional funding that we're seeking will be dedicated to expand the services. If we are able to raise the entire amount to buy a building, the money that we're using right now to pay rent will go back into the center for expanded services. Again, some of the expansion of services is that we will create an outreach or intervention personnel that will be out talking to the schools, to the high schools, middle schools, and maybe even elementary schools about child abuse. We will connect with clinics in our area and make sure that they know that we are here, so that when they see children and they have a question about a child that maybe has suffered abuse, that they can call us and we can be a resource to them. We serve between 100 and 160 children a year. With this campaign and the expansion, we will be able to double that capacity. In the form of seeing more kids that have suffered abuse, one of the things that we're working on with our law enforcement is when they are out on a call for domestic violence. Sometimes those domestic violence calls, one of the parents or both sometimes will get arrested. If there's children in the home, we know in studies that being witness to domestic violence is just as harmful as if you were the target for abuse. So we really want to get out and be able to see those children as well. And then hopefully it will eliminate any wait time that children have to wait to come in and be seen once we are fully staffed. Our goal is to raise $2 million. And this is kind of the breakout of this. 1.1 will get us a building, a 4,000 square foot building. 400,000 of that will be to renovate any building that we purchase. Will need to be retrofitted for what we do. And then the 500,000 will establish the Safe Space Hope Fund, and that will ensure that when we got our new building, we're moved in, I can hire the staff needed to add those other services that we don't have. Oh, the one piece that I didn't mention is mental health. We don't have a mental health therapist on board. We contract with somebody and we do referrals, but in order for our team to be complete so that we can holistically do an assessment on a child, we really do need the mental health person in here. I always want to say that we need to provide those high quality child abuse assessments, the kind that you get in the metro area with the CARES Northwest or with the Liberty House in Salem. a child that's abused, suffers abuse in Gillum County should have the same level of care than a child in Multnomah County. And we can do that because we are pooling our resources by combining all of our resources. Individually, we're too small of a counties and our population is too small to provide a comprehensive center like that, but together we can do it. So this is the plan on how we're hoping to raise this money. $100,000 will come from special dedications, hopefully. Major rooms or building naming. I mean, if somebody's going to write me a $500,000, I'd be happy to put their names on our side of the building. 500,000, we've identified 2 to 4 foundations that will support us. Collins, Ford, Meyer, Murdoch. I think those are the foundations that kind of align to what we do. 400,000 of that hopefully will come from 20 to 30 major gifts, anywhere from 5,000 to 50,000. And then the last part of it, the last 100,000, hopefully will come from that really grassroots community members. And this is a really important part because our foundations want to see those $10 donations from grandma down the street, because they want to know that our community's invested in the work that we're doing. So, you know, they want to see those small donations. Somebody that says, you know, I can't afford a lot, but I support you. Here's $25. So I'm hoping that will happen. Like I kind of mentioned before, 500,000 will get you a building dedication. 50 to 100 will get you a dedication for one of our rooms. The center in Eugene, Kids First, completed their capital campaign for their building a couple years ago, and the Springfield Police Department said, we will take on the observation room. We will make that happen for you. So I'm hoping that something like that will happen. Maybe one of the clinics or the hospitals will take on the exam room, because that's where we do the medical exams. And then major gifts can be pledged over 5 years. So 5,000, 10,000, 25,000. Those can all be pledged for 5 years. So somebody may say, you know, 5,000 is a lot of money for 1 year, but I can do 1,000 for the next 5 years. So those can be done that way. So right now, we've been talking to a lot of people. Mike came and we did this presentation to him, and we're talking to some other folks. We're kind of in the feasibility phase of it. We're talking and asking for some feedback. Once we have talked to enough people, we'll come back together, hopefully middle of July next month, and say, okay, you know, we've got good feedback, or maybe this isn't the time to do this, or whatever. Hopefully we will say, okay, we've got really good feedback and everybody's supportive. We can start our capital campaign. And for 1 year, we'll do kind of a quiet phase. We'll be talking to people, securing some donations, some grants. And then the last year will hopefully be where we're kind of topping up our campaign. So that's kind of the timeline of what we're doing. And that's kind of it. I really went really fast with this presentation, you guys, because I know I don't have a lot of time, and I do want you to see our video, but do you have any questions?
I've got one, Beatrice. You said, I believe you said that you're currently seeing about 150 kids a year, and with this, you'd be able to see 300. So where are those kids going now? What happens to them?
A lot of them, the police department or the police law enforcement are doing their own thing. A lot of them just start coming here. You know, we want to really increase that and make this a place where all of those assessments come here.
So they're just not getting the services?
Right. Well, somebody's seeing them, but the police may just do their own, you know, quick interview and go from there. A lot of them, like DHS does assessments on severe maltreatment or that kind of stuff. Those need to be seen here, and our doctors can do a medical exam for those. So yeah.
So they're not getting the quality of treatment, is
Right.
what you're saying. Okay, thanks.
Yeah.
Beatrice, in the, this presentation that you just went through, I have the hard copy that you gave me. You were talking about this region having approximately 1,500 children
Mhm.
a year that need a secure place. And you're now serving about 150, hope to go to 300.
Right.
Is that correct?
Yeah,
So
that's correct.
this is still, even if we can get to 300, we're quite a bit below what
Yeah,
actually the need is right now.
right.
correct?
And I think what the outreach person, if we're actually going out to schools and doing presentations and stuff, that's, I think, where we're going to get a lot more referrals as kids start hearing the information and go, whoa, something's not right. I need to be talking to somebody about this.
Beatrice, this is Karen. When you
Karen.
talk about the region, the last I remember hearing is that the CAC was also serving Wasco County.
Yes.
So is the region Hood River, Wasco, Skamania, Klickitat?
So right now it's Hood River, Wasco, Gillum, Wheeler counties, and Klickitat County. At some point, I would like to get Skamania and Sherman County here as well. Again, I just can't tell you enough how bigger voice I have in Salem when I go talk to, lawmakers, and I can show them this is the area that I cover, that our center covers. It's not big population, but it's a big area, and there's kids in every corner of that area. So yeah, eventually I would love to be able to serve all of the gorge. And we're pretty unique because we serve across state lines. There isn't another center in Oregon that does that. There is other models in another place in the United States, but in Oregon, we're the only center that serves across state lines. Which makes a lot of sense because our families move back and forth. I mean, we've got, families that live here and, go to school there or whatever, vice versa. So.
Well, I wish you luck in finding yourselves a spot in our difficult market. So I definitely will keep you in mind if I can
Yeah.
help and think of anything, but because I think the program is fantastic and super needed and
Thank
very
you.
well supported. So good luck.
Yeah, we've had a lot of really good feedback from, especially from Wasco County, because they were the last county in the state of Oregon that contracted with the Children's Advocacy Center. So their DHS workers and their law enforcement were always scrambling to figure out what to do. Most ERs don't want to do an exam on a child, especially a toddler that has been sexually abused. ER docs just throw up their hands. They don't want to deal with that, and they're not.
Well, nor is it remotely appropriate to do so.
Yeah, and they're not equipped to do it either. So we've had a lot of good feedback from Wasco County. So one of the things that I know that is happening is that city has about 7 acres and the county has about 2 acres that you guys are looking at for affordable housing, maybe a joint project together. And I have approached Kevin Liberty, is that his last name? About buying a plot from that. And I don't know where you guys are at with that, but if that's possible, because we can fit into any theme of a neighborhood or that area. We don't have to look like a medical clinic. And as a matter of fact, we prefer not to look like a medical clinic. So that's something that maybe you guys can think of as you're moving forward, that we would love to be able to buy a plot. And we've been in a neighborhood before. We've gotten a conditional use when we were on Wasco Street. So that's not something new.
Beatrice, can we see now if the presentation's ready to roll? We're going to run out of time here
Absolutely.
pretty quick.
Okay. Heidi, were you able to find that?
Beatrice, you had not sent me the video. You had just sent me the PowerPoint, I believe.
Oh, I didn't send you the link. Okay. Let me see, how am I going to do this? I can't get it going. I'll send you guys the link, and then hopefully you guys can look at it.
That'll work just fine, Beatrice. We're pretty much out of time anyway. But
Okay.
We
I'll send-
certainly appreciate your time and effort on this, and we know it's a really, really important position, and that's why I wanted to bring it before the board. Any other questions by any of the board members?
I was just wondering, Beatrice, is the plan to hire a professional fundraiser, or do you have some staff already on board, or how's that going to work?
So we did hire a consultant to help us do this capital campaign, because obviously this is not something that's in my wheelhouse or anybody, any of our board members. So we did hire a consultant, and he's the one that helped put this presentation together, talking with Kelly and I. So yeah.
Great, thank you.
Yeah, thank you. And I'll send you the link, or if you go to our website, we've got a really cool website now. It's on there, both in English and Spanish. So I do urge you to look at it. It's about 4 minutes.
Thanks.
Okay, well, thank you very much, Beatrice. We appreciate
Thank
the
you.
information and keep up the good work. If there's something I could do to help, let me know.
Okay, thank you
And,
again.
We have to continue with our meeting from now. Thank
All
you,
right.
Beatrice.
Bye-bye.
Next up, annual reports for Hood River Watershed Group and the Hood River Soil and Water Conservation District. First up, Hood River Watershed Group, Cindy Thyman.
Thanks, Mike. Can everybody hear me okay? All right.
Yes.
Do you guys want me to pull up the two-pager that was included with your packet, or do you want me to just talk? So the advantage being that I can see your faces if I don't put up the two-pager. But if you guys haven't seen it or looked at it, I can.
We have the packet.
You've got the
I
packet.
have the packet.
Okay.
Everybody have the packet?
All right.
We're good.
Very good. Okay. Thank you. It's nice to actually not talk to the void during these things. So it's nice to see everybody, and it's been 2 years since we've gotten to see your faces all at once, at least together. And I just wanted to share highlights from this past year that the Watershed Group has been involved in. Like you guys we have migrated to Zoom for our public presentations. Starting in September, our Watershed Group meeting presentations moved to Zoom. And obviously there's some downsides to not meeting in person, but we were able to pull in a lot of speakers from, out of town, a couple out of state. And so that was a pretty cool silver lining for us, for the pandemic, from the pandemic. And we launched a website for the Watershed Group last summer. And so on that, and I put the link in the packet. So if you see it digitally, you can, it takes you to the spot on the Watershed Group website that has those meeting presentations recorded. And so, if you're interested in what the latest is on the steelhead in the watershed, or, there was one on, how climate change is impacting forests in the Pacific Northwest. That was done by some Forest Service, regional Forest Service staff. There's a pretty broad range of talks that are recorded. And so that's a nice feature. And I think we'll probably end up doing some, even when the pandemic is over and we can meet in person again. I think we'll still do some number of Zoom ones, just to, provide some variety. And we also need to figure out how to record, do recordings because it's really nice to be able to put them on our website because there's only a certain cross section of our population that likes to come to in-person meetings in the evening. So it's good to provide options. So we're at the tail end of getting out our watershed action plan. And that's been a long 3-year process. Right now it's out for review by the partnership. And the partners on that plan, it's the Watershed 2040. So it's, 20 years of actions that are really targeted to helping recover the salmon and steelhead and bull trout in the watershed. So the strategies are tailored for the Hood River watershed, and to address the limiting factors that are in this watershed for salmon and steelhead. They're consistent with what Oregon Department of Fish and Wildlife Service has suggested as recovery actions for our watershed. And we're all on board. So, Middle Fork, East Fork, Farmers Irrigation District are signers of the plan, or will be. Forest Service, the local Forest Service office, the Conservation District and the Watershed Group, Confederated Tribes of Warm Springs, Department of Environmental Quality, and ODF&W. So it's a diverse group of partners that are signatories to the plan. And it talks about the limiting factors. It really lays out right now the long version is out and it's about 110 pages, which is more than most people are up for. But there will be a 20-page version that'll be a lot more palatable for the general public. And so that might be something you want to have, just available to you. But it really covers what are the issues in our basin for salmon and steelhead and bull trout. What are we planning to do over the next 20 years? So specific strategies and actions on the landscape, sort of really quantifying how much water conservation we're targeting in the next 20 years in the ag sector, but also some new areas. And I've mentioned them before, our interest in exploring a water bank. So being able to compensate people who are growing crops that could be fallowed without too much damage, and be compensated for it during a drought year. So that's what a water bank would function as. And also increasing efforts in residential water conservation. I think that is a big area that we need to expand in. I know, both Farmers Irrigation District, City of Hood River, East Fork Irrigation District, all of those supply a lot of water to, just residential properties. And there isn't a lot of guidance on what, how to conserve at the residential level. So one of the things I'd like to do is develop a residential water conservation guide that county and city residents can get behind. Because there is, even though irrigated agriculture still does consume, use most of the water, I think that the residential it's going to increase as our population increases. And what I'd like to see is that our per capita use decreases, so that potentially we don't actually increase our residential use in the next 20 years, where if everybody conserves, like 20%, we may actually be able to kind of keep that steady. And some of these residential intakes are pretty high in the watershed, so their relative impact is can be somewhat big, like on Lake Branch and the upper East Fork Hood River. So I think it's worth paying attention to. And then, another new area, we want to continue with the stream habitat restoration. There's been a lot that's happened on the upper West Fork on Forest Service land, but we really need to move to different parts of the watershed. And the East Fork Hood River is one that that's really the kind of a stronghold for the winter steelhead in our basin. And so you'll start hearing about restoration projects that are happening on the lower East Fork Hood River and the upper East Fork as well. And then I included the picture of the mouth of the Hood River. I stole these from your presentation, Les, I think the sense of place talk. So I can't remember which.
I'm sorry, and Les stole those from me.
Oh, and Les stole them from you, Arthur. So I'll credit you, Arthur.
Arthur gave me many of my pictures, which I did say in my presentation.
I was looking, it's like, wait a minute, I know that picture.
Good,
Well,
Arthur. So
yeah, Genevieve. It was Genevieve at the port and Arthur for those.
Okay.
It was
Arthur, now I know who I need to ask for the credit there. So I'll follow up with you, Arthur.
no, I'll keep taking credit. No, absolutely.
Okay, yeah. So I know we probably all have a general sense, but I think seeing what the Delta looked like before and what it looks like now really speaks a lot, you know, sort of 1,000-word sort of thing, because we have really simplified the mouth and kind of created zero habitat that's really viable habitat for juvenile salmon and steelhead, and also salmon that are migrating by, despite the fact that, you know, the Hood River is one of 14 cold water refuges on the Columbia. But ODF&W doesn't really see that it's being utilized by salmon. And so it's, you know, migrating by. And I think it's just they suspect, and it makes sense to me, it's so simple. There's no structure, you know, there's not wood. It's a far cry from what it looked like in, you know, in the early 1900s. Not that it would be realistic to get it to look like what it, you know, did back then, but I think there are things we can do as a community to definitely improve. So I might be having conversations with some of you about that in the future. And then just a couple project highlights. East Fork Irrigation District, they just got the first phase of their East Side Lateral project done. And again, and that was very tied to the county, because most of the new pipeline section for this phase was on county forest land. And so that might have a vague recollection of approving that easement. The open canal was already on county land in a different spot. And so it was just a switch to putting the canal it's still currently open. The canal is still open, but that will be filled and renovated as soon as the whole pipeline is completed. So thanks for your support on that. But that has been, it's a huge fundraising effort. To date, about 6.5 million have been raised for the project. About 3.5 million has come from NRCS, 2 million from Oregon Water Resources Department, 500,000 from OWEB. The Warm Springs Tribe has contributed to the design and purchasing pipe. And so I think altogether the tribes have contributed over $1 million towards the project. And the East Fork's hoping to get the final amount here this year to complete the project by spring of 2023. So that will be really nice to get that complete and behind, because East Fork still has a number of other pipeline projects to do. And then we have really started to work in the Neal Creek watershed stream, and have a number of private landowners on board with improving in-stream habitat for steelhead and coho. Last fall, my project manager saw a coho on Lower Neal Creek. So it's pretty exciting to see them coming back and being able to know that we could really improve conditions. Neal Creek's very straight. It's one long riffle, kind of like you see in the picture that's included here. And what we'd like to see is some deep pools. We want to see more large wood, which is tends to be conifers that stick around, so that we have better spawning habitat and better holding habitat for those smaller, juvenile coho and steelhead that they're in the basin for, up to 2 years for steelhead, up to 3 years for steelhead. So, and actually, coincidentally, we do have a little bit of land for our project this summer. We need to access Neal Creek across some county property. And so we appreciate that in advance for helping that happen. And looking into the future, there's quite a few pieces there's a number of county land parcels where the East Fork Hood River goes through, or Upper Neal Creek. And we're interested in collaborating with the county possibly on improving fish habitat on county land. So, any questions?
Cindy? I have a document which is sort of it's full of wonderful chunks of data that seems to be dated about 1995 or so, summarizing all the details of the watershed. And I pull it out all the time when I need some piece of information on how much water is consumed by various uses and things like that. So is the plan that you're working on now, is that basically an updating of that document?
Well, what I'm not sure which document.
Okay.
You should, but yeah, would you email me what that document is? But I think the answer is yes, Arthur, because I spent a lot of time making sure that either references or data itself. So for example, the in-stream water rights, I have an appendix that shows the in-stream water rights in the basin, and the flow data, the monthly flow data that's been collected by the tribes and OWRD and ODF&W that compares the in-stream water right versus what's actually happening. So some details like that are in there.
Yes, exactly. I have a hard copy of it. It's sitting in a pile. There's about a 2-foot high pile of papers to my right here, and it's in that pile. So I'll dig it out and I'll show it to you.
Yeah, that would be good. Yeah, I can't I mean, there's a long reference section. So if I haven't included that document in the references, I might want to, so yeah.
Cindy, when you're talking about restoration of natural settings like woods and trees and things, are you talking about on the mouth itself?
Well, I personally would like to see habitat restoration at the mouth. And I don't know if I'm totally understanding your question.
Well, you were talking about that's what we need to do to help the coho and whatnot, but
yeah,
I couldn't understand. Are you actually proposing that we do that at the mouth?
Yeah. Mm-hmm. That's it would be a collaborative thing. I mean, that it would take some it would be a big lift, but and it would involve Nichols Basin. I'll just say that.
Oh, okay.
But it will take a lot of legwork and, you know, broad-based support, conversation with the recreation community, obviously start, you know, and it's something that I have talked with Michael McElway at the port about. So I know that the port is, you know, potentially open to the idea. It's not a hard, you know, no way. Yeah.
Well, a lot of that land out there wasn't there about 10 years ago.
Yeah.
You know, so it's kind of like new land. It just takes a long time for something to develop on it.
Yeah.
Well, part of the problem is that people keep on removing all of the wood from it and burning it every year.
So,
Yeah.
So yeah, for the first time, it was great. I went out, somebody from I can't remember the acronym, but somebody that was part of that effort this summer, that weekend happened. It was a couple weekends ago, and they said, we're not going to burn it. And if it's buried, we're not proposing to move anything, but we would just like to kind of move it. And so I suggested, with the caveat that I'm not representing a regulatory agency and couldn't say whether this is, you know, is something that would require a permit. But I suggested that they move it into be in contact with the water. So the edge of the Hood River and the really kind of the ephemeral wetland area that's on the north side of Nichols Basin. And I haven't had a chance to go back down there to see where exactly they put it, but I think they tucked it into the, you know, to the edge of the river and the you know, water. So, I mean, really the loose stuff that's on the spit is just going to get whisked down the river. It's not really going to serve as fish habitat if it's just lying loose. And so it seemed to me that my unofficial advice was to try that. And so I'm going to go see what it looks like and take some pictures and see if it sticks around.
Okay, are there any other questions for Cindy? Okay, thank you, Cindy. Next up on our agenda is the Soil and Waters Conservation District with Heather Hendrickson. Heather?
Hi, commissioners. Thank you for allowing us to speak today. I think I will bring my presentation up just as a little bit of visual aid. And the pictures are in color, so that might be kind of nice. I'm the district manager at the Soil and Water Conservation District here in Hood River. And I am just presenting some overviews of the programs that we run on a year-to-year basis. So basically, we are the local management agency for the Oregon Department of Ag, tasked with implementing the Ag water quality area plans and rules. We work with landowners on a voluntary, non-regulatory basis to assist with issues that they might be having on their land. And the main natural resources concerns that we deal with are waste entering our waterways, and then insufficient shade and vegetation around streams, because that's very important for minimizing solar heating and erosion, filtering sediments out, and keeping the water temperatures cool. So basically, we assist landowners when they call us or need some assistance, and we try to advertise these programs out there. These pictures right here are an example of a project that we just wrapped up this past year in the Odell watershed. So this was a small stream that goes under the road and then joins Odell Creek. And it was heavily trafficked by cattle with no fencing or any kind of riparian vegetation. So we had a fairly large grant from the Oregon Watershed Enhancement Board, and we fenced off this creek, and we provided some cattle crossings right here. So this is a hardened gravel area where the cows can go down and drink water. And then we planted this area. So hopefully in the next few years, we'll see these plants grow, and this will be nice shade cover for this creek, and the cows will be kept off, and so the grass grows and provides that very important function. Like I said, we work with the public, and this past year we had over 100 phone calls. We had a bunch of walk-in clients before we closed our offices due to COVID. And we did go on site visits. We went on 24 this past year. Normally it's quite a bit higher than that, but during the early part of 2020, we weren't doing very many site visits, but we've picked that up again this year. So I just pointing out that we respond to calls from anybody, people with lots of land, big projects, to people with 1 or 2 horses or a cow. So we work with anybody. We administer a small grant program through the Oregon Watershed Enhancement Board, and our biennium is about to start in July. So we'll be getting another $100,000 here for the county to do projects up to $15,000 each for landowners. And a lot of these projects are irrigation upgrades. So we're working with orchardists to upgrade from high flow sprinklers to a more low flow sprinklers, saving water. And we also do a lot of manure storage and sort of these mud management projects where we help a landowner harden off their high use area to avoid mud and things like that. So we're still looking for people. We're advertising right now. We're still looking for people who want to do a project. So keep that in mind. Like I said, we'll have $100,000 in our hands in July to work with for that. We are wrapping up another biennium of pesticide monitoring through the Pesticide Stewardship Partnership Program. And we're pretty confident this will continue again for the next biennium. So we've been doing this project for 22 years, and you guys have heard about this, I'm sure. We take samples in a couple local streams, and they're analyzed for over 130 herbicides, insecticides, and fungicides. When this project started, a lot of good work was done on best management practices around pesticides, and that helped really reduce the detections in our area streams. And that work is continuing. Some good news to report this year that the number of individual pesticide ingredients and the number of detections were the lowest since sampling began 22 years ago. So we're definitely on a good track with that, and hopefully that trend will continue. we are still doing groundwater monitoring for the county. We had an agreement with the county that we're going to keep doing this until 2026. We're collecting all that data, and sometime in the next few years, we'll have a report available for you all that shows the elevation of the wells and what's going on with the groundwater. Good news is we don't think much is going on with groundwater right now. So, and then the last thing I really wanted to highlight was our weed program. So we have a Weed of the Month campaign where we put an article in the newspaper, try to hang flyers around town, and do a radio spot highlighting the weeds of the area. I came here in 2018, and in June of 2019, the IGA, the agreement that we had with the county to act as the weed board expired. We are doing minimal amount of work around weeds. We're interested in talking with the county about how we can help and do more, either with planning, prioritizing. Potentially, we're interested in signing another agreement with the county to serve as the weed board until such time as there's another plan going on. And we could reconvene the weed board group. Probably need to see if people are still interested in doing that, just to help with that process and help the county out with some of the weed issues. On that note, we're still doing garlic mustard control, but this year we don't think any garlic mustard plants went to seed, which means we are really getting a handle on this infestation that's up in Parkdale. And we have funding for another few years, and we're applying for more. And so we hope that we will be eradicating this weed up there. The seeds are viable for 8 to 10 years. So if we can not have any seeds set, we'll keep monitoring for plants that come up, and we have a good chance of eradicating this weed here in the county. So that's all I have. We're still closed to the public right now, although we probably will open up again soon, but we're always available by the phone or email to help people out. That's all I have. Thank you.
Any questions for Heather?
Yeah, Heather, on the groundwater monitoring, this might be to both you and Cindy. Is the plan to rerun the groundwater model, or to basically do an updated groundwater model once all that data is in?
Let me remember, we had some discussions with OWRD and USGS, I believe, or whoever ran the original model. They didn't think the data we were collecting was going to be sufficient enough to rerun the model, but we should talk about it. And then if we want to redo that, collect some different data that would inform that. Is that, Cindy, what you kind of remember?
Yeah, I did have a conversation with someone from Bureau of Reclamation. I don't think it wasn't the person that did the groundwater model before, but I think that the question, the uncertainty still is, we can add the data, but it wasn't clear that it would be any more conclusive. And I think that we would need to do, I think the additional piece is to actually look to see whether there are gaining or losing reaches of the river. And that's kind of a piece where how much connectivity, is at least groundwater in a portion of the basin to the river in streams. And I mean, generally, the hydrologist with WRD said, it's probably really connected, and so I think that kind of a study would still be worthwhile to look at, to go do flow measurements at the sort of the driest part of the summer to see if we have gaining and losing reaches of the river.
Can you not use thermal, which I know has been done in other basins? Is the thermal imaging not far enough along? Because that seemed to be the most cost-effective and quickest way to figure out your gaining and losing reaches.
I don't know technically, Les, and so that I would love to actually do thermal imaging, because it would not only would it maybe get at that, but it would also help focus fish habitat projects.
We have some folks here in the valley that have a little bit to do with drones and imaging. We should
Right. We should talk with them.
we
That's
should talk with them. Yeah.
Yeah, that's a good idea. Yep.
Can someone give a dummy's guide to what is a groundwater model?
Oh, Les, you should answer that.
I don't care who.
So I mean, I'll just tell you. Originally, when we were doing the basin study, the thing that we knew the least about was groundwater, and so the groundwater model that was run, which is really looking at surface water groundwater connectivity and kind of seeing how water is moving in the basin. So say if you decided to do an aquifer recharge, so you decided to take some winter water out of the stream and put it into the ground. Is it going to hold that water for a long period of time and then slowly release it into the stream, or does it go somewhere disconnected? Like, we just don't know enough because we're such a surface water driven system. So we had a ton of questions about the geology and how water moves subsurface. And so what you don't know, I guess one of the big questions and concerns down the road was looking at if you see more agricultural wells being tapped because of lack of reliability of surface water and then water quality, which we have horrible water quality issues late in the season due to sediment. Is that going to then draw the river down further? So is it so connected that as soon as you start tapping large wells, is that just going to start affecting the surface water flows? And so when you look at gaining and losing reaches, you start looking at where is water coming into the system and where is water going out of the system? So where is it interacting with groundwater? And you can see that by, you'd see colder areas where water's coming in to the river and warmer areas where the river's losing flow.
And so are you saying that we do not have a groundwater model, or that it needs to be improved, or?
It needs to be improved.
Yeah.
We were lacking data. We were lacking information. And so the intent was to establish well monitoring. So of the 400 or 500 wells we have in the county, would we monitor 60 total? Is that what we got up to?
We do about 20 and OWRD does the rest. So probably no
Around
more than
50.
60.
Yeah, 50 total. Yeah.
So we kind of tried to spread them out around the county to be able to get a good coverage of the county, and then use that. You're basically monitoring the level of the groundwater through the season.
Mm-hmm.
And there's something to be said just for having this long-term record established, because that was the other thing when Lesson started it with, we guys started that project. There was, I think, 12. I mean, there just wasn't very much data, period. And I think it has there's potential maybe for groundwater recharge projects in the hood. I think it would end up being up in the Parkdale area, and that then potentially it could benefit stream flow downstream in the summer. We don't really know, but I think some level of groundwater modeling is in the future, for the partnership.
Really helps you target, and I think the interesting thing that's been done in other basins with the thermal imaging is focusing efforts on cold water spots. So within the system, cold water refugia. So you're able to focus your restoration efforts on those areas where the fish are likely to be holding in the most difficult time of the year.
Mm-hmm.
Any other questions? I would like to make a comment to Cindy and Heather. Cindy, you brought up the fact that we're trying to do more piping. East Fork's doing a big project. I know Les is looking at piping some more. Heather, you were talking about using the micro sprinklers. I just want to reiterate what I've been saying for years. We really need to get the water clean at the head of these pipelines. If we can ever do that, we can be so much more efficient, economical, and biologically sound with our disbursement of our water into these grounds. We could go not only to micro, we could go to drip, which would be even more efficient and less water use and accomplish the same thing. But our water is just too darn dirty. We need clean water at the heads.
This year's been atrocious. This has been one of the worst years. It's just,
sure has.
And this is before the sediment. It's just, there's something in terms of algae and organic that's basically heavier this year than we've seen. I mean, all of our growers are struggling. It's not sediment. I'm not sure. It's just different this year.
It's wind too, because a lot of it's fir needles.
Yeah.
Oh, yeah.
Okay, well, thank you, Cindy. Thank you, Heather. Keep up the good work. And I look forward to things getting cleaner and new projects coming down the road in the future. Thanks for all your work.
Thank you.
Thank you.
Next up is our COVID-19 update with the Health Department. Erin's on.
Hello, nice to see you all. I am going to be stepping in for Trish and providing the update today.
That's great.
And
It's all
anything
yours.
I can't answer, I'm happy to take back to her and I can follow up with you all on. And I'll just dive right in, and please stop me if you have questions, and I'll take any questions at the end too. Just thought I'd start off with letting you know right now we have 9 active cases of COVID in the county. But our hospitalizations and death toll have stayed largely consistent over the last few weeks. So that's a bit of a change from earlier on. We're seeing about 4 or 5 new cases a week just over the past couple of weeks. We just got in new vaccination rates from OHA. And so among our 16 plus population, we have 70.32% vaccinated. And that's a little bit higher than other quotes we've seen because that includes federal vaccinations that were done. So anyone who is incarcerated and was vaccinated, or anyone who's in a long-term care facility that had a partnership with a pharmacy, and that's how they got vaccinated.
So Darren,
yes.
since you're on that subject, and now you're talking 16 and over, not 18 and over?
16 and over, yeah.
We are over 70% at this time. So we've already met the goal of the governor.
Well, the governor's numbers don't yet include the federal population, those additional vaccinations I was talking about. But when I spoke with OHA, it sounds like they're working to incorporate all of that. So we're all within a percentage point or 2 of the number that were quoted.
Well, the governor's goal was for 18 and older, and we're marked on that sheet as having met it.
Yes.
Yep.
It's
Okay,
a little,
good.
it's a little confusing too, because the governor goal of the 70% statewide is for 18 and up, but the 65% that's each county's goal is among 16 and up. So I'm not sure why they use different, different metrics for the 2, but
You keep us awake.
I'm trying to keep track of it. Yeah. So we also, in newsworthy update, we had a visit from Governor Brown last week to One Community Health to see the vaccine clinic there. Chair Oates, I believe you were a part of that too. So I'm sure you all were aware of that. We have the
pretty big secret, actually. We weren't even, I wasn't allowed to tell anyone.
I was going to say, I found out day of.
No, I haven't heard about it.
Oh, well, it was in the news, so I feel like hopefully that's okay to say now.
I should read that.
Yeah. Yeah, a visit to another production facility, to a glass production, Cardinal Glass, I believe. So it was One Community Health and a visit to the glass production. We do have the FEMA trailer up and running out in the Dalles. It's parked next to One Community Health's downtown location there, and we'll stay there for a few weeks. Cherry harvest is set to start within the week, so they're hoping that they'll get more and more folks coming to the trailer for vaccinations. We currently, in addition to holding our Thursday regular drop-in hours at the clinic at the health department, which we're seeing pretty steady rates of people coming in for vaccines, we're also responding to pop-up requests right now that have been coming in. So I believe I updated you all in the weekly summary that we went to Fish Food Bank last week. We're working on going to Cascade Locks in the next 2 weeks. And then we also had a request from a farm owner up in the Upper Valley if we could do a pop-up clinic there. I'm also working on getting a standing pop-up vaccine clinic, hopefully in Odell or Parkdale. I'm identifying a site right now where we could just have every 2 weeks or so have a pop-up available there. We also are planning initial conversations of having a booth at the county fair to do vaccinations there as well. And I did just receive news that One Community Health does have their mobile unit available now. So we may be able to use that to visit farms and orchards who are having H2A workers come in the next few weeks. So go throughout Hood River County to responding to requests from farm owners. And we've just, as a recent update, our website now has a menu of all walk-in clinic opportunities throughout the county. So we're continuing to keep that live and dynamic so that it's up to date for anyone who needs a vaccine. And I think that's all I had for you, but I'm happy to take any questions.
Darren, can you address the trend in vaccination rates?
The trend,
What is the trend line? How quickly is the rate of vaccination dropping, and what can we do to keep it up?
sure. Well, I'm seeing from the OHA data that we're increasing by about 6% each week. There are other counties that are around 8, some that are around 3. So it seems like we're at a pretty steady rate of increasing. I can tell you anecdotally that at I work all of our Thursday clinics, and I do the intake there. So I get to talk to folks who are coming in, and I always ask how they heard about us. But it seems like we're getting a lot more folks who were kind of using the wait and see model, waiting for a few months, waiting until more people they knew had gotten a vaccine, and now are starting to come into the clinic. So I'm seeing more steady trickle in of people who were initially hesitant, but have now seen the positive benefits of getting vaccinated. I think things we can do, I'm fully on board with an every shot counts model now. So I'm happy to go to whatever clinic requests there are, even if it's just one person that gets vaccinated, because that's one more than we would have had otherwise. I think going to where people are is really, really important. So these more mobile type clinics, I think, are really exciting. Also, incentives have been really influential. Right now we're doing, I believe I mentioned this at the last meeting, but we're doing $30 gift cards to through Gorge Grown, so they can be used at the farmer's market or at any of the mobile market sites. And then I'll be identifying another local business that we can highlight. We previously used the Hood River Taqueria, perhaps a site in Parkdale or something where we can give some money to a local business and in turn give incentives out, because people seem to really like those. I'm not sure if it's why people are coming for a shot, but it's definitely a nice cherry on top.
So, I see every couple of days there's an event down at the soccer field down at the waterfront. Seems to be a lot of folks who show up for those, and I'm assuming we're starting, there's more outdoor sports happening, intramural leagues, that sort of thing. Are we capable of providing vaccines at those locations, or has that been discussed?
That hasn't been discussed, mostly because all of the under 18 vaccinations have been done through the school-based health center or One Community Health, but I do know a lot of people were incentivized to do it because they wanted to get back into playing sports. So I think if that felt like it was a worthwhile location to go to, I could definitely take it back to the team and see if we can do a little pop-up stand down there.
I think there's a lot of adult leagues that play also. I don't think it's all kids. Yeah.
Great.
I'm not sure. I mean, you might check with the port. It's their field. They do the scheduling of it. But I'm not actually talking about that field in particular. I see this time of year, you start to see things outdoors all over the place, and it's good concentration of people, and they're in the age range that is still weakest in our demographics. So perhaps there's some ability. So from your answer, it sounds like you are capable of going to a site like that.
Well, they would need to be indoors, I think, is the tricky part. Until I haven't seen One Community Health's unit yet, and I believe that'll probably be reserved for going to more rural locations. But what we've been doing is just piling up my car with the supplies that we need and then setting up in a conference room or in a classroom or something like that where people can come in. So heat is obviously an issue. Wind is obviously an issue. So the elements we kind of have to battle the elements, but there are a lot of businesses down there that have been great partners. Heart of Hospice is right down on the water there, and they do walk-in vaccinations. So it may just be letting everyone on the field know, like, hey, they're doing them right now, 1 block away.
And there's corn dogs.
Yeah. And there's something there for you.
I can tell you that One Community Health's portable vaccination site, it looks like one of those large Mercedes vans that you see running around in Hood River. I mean, and it looks brand new, and it's great. It would be really easy I would think, to go to a soccer field and have all the people there that wanted to just get. The governor took a tour of it while she was here, and I had to fight the people off, make sure they didn't lock her in there. But anyway, I didn't get to go in because you could only get in 1 or 2 people at a time. But from the
Mhm.
outside, it just looked like an incredible setup for a vaccination process
Great.
for being portable.
Great. I'm excited.
Any other questions for Darren?
No, I'll just say I think we continue to be, a lot of the state looks at us and wants to know what we're doing right. So I had the AOC panel here, was it a week ago? Arthur was on it. It was an interesting discussion amongst the counties in terms of, yeah, I mean, we got to, hear from Umatilla County and, kind of the issues they've had and how they've been, earnestly trying to get their numbers up, but also some interesting perspectives from some of the other electeds from around the state. So,
Mhm.
but it was
surprising to me was that 2 different counties commented that they had physicians who were actively discouraging people from getting vaccinated in their county. So
Yep.
we were very fortunate not to have to be dealing with that here. You folks are doing a great job. I hope that you know that anything that you need, please make sure we know. We've got money to spend on this, and it's so fundamental and critical to keeping our orchards, our packing plants, our factories, our schools open this fall, that we get the numbers up to the absolute maximum we can get them to. So let us know what we can do for you.
Thank you. I appreciate
Yeah,
that.
just want to reiterate that as Arthur's saying, we have these ARPA money, and our number one
Mhm.
goal is to make our community as safe as we possibly can with the funds. So
Yes.
come up with ideas, Darren, or need a little money to be put someplace, let us know.
Okay. Thank you.
Also, you're talking about, they want to know how we were doing it. The governor asked that question when we were at One Community Health. And of course, she asked me. And so I just pointed to Trish Elliott and Dr. Van Tilburg and the One Community Health Facility. And I said, these are the people that have made it work.
Mhm.
And you weren't there, and I pointed to you too.
Well, they're my team.
I did mention that to
Oh.
the other counties that I think one of the really good things that we did was hire the position that you're filling, and just felt like it's made a big difference.
Thank you.
It really is so important to have someone whose job is full time on this, so that they're not distracted by all the other things that come through the door, just basic management issues and things like that. It really, I can say that you guys were smart to do this because you did it before I was on the commission. So I'm not patting myself on the back, but it was obviously the right thing to do. Now, in retrospect, we see that it was very powerful in helping our county move along.
Yeah. Thank you. Yes. When I work with other counties, I'm like, do you have anyone in my role that I could talk to? And they say no. It's like, okay, well, so I'm appreciative. I think it's good to have somebody who's connected in all ways. So
yeah, I think you've done real well, Darren, and it's been a good process. Any other questions for Darren?
I had one. I just wanted, there was a little bit of back and forth about the different age groups and the percentages. I just wanted for clarity for all of our listeners and myself. The county goals of the 65% apply to 16 and over, and the governor's statewide goal applies to 18 and over, and she wants everybody to be at 70% statewide to eliminate the restrictions. And as I understood, Hood River County has met both. Well, obviously the
yes.
16, but okay.
Yes, we have. And I want to confirm those numbers too. If I can do it quickly, I will. But otherwise, I'll send a follow-up.
And then also, are there other counties that are at that same rate, or is Hood River one of the few that have met both of those benchmarks?
I believe the only other 2 are Benton County, and Washington County just got up there as well.
Okay, great.
And it seems like Multnomah County is pretty close from what I understood.
And those numbers are based on first shots. So those are people who've gotten at least 1 shot, not fully vaccinated. We're actually doing quite well in terms of people fully vaccinated also. Something between 53 and 59% are fully vaccinated, depending on if you listen to the CDC or the Oregon Health Authority.
Right.
Thanks,
when we met with Leah Horner last week, I asked her about these numbers to make sure that I was concerned that, some of these counties aren't going to get there. And she said, no, it doesn't work that way. It's for the whole state. So it's accumulative. So if you have some counties that aren't at that rate, but the whole state numbers are at the 70%, then we've met it.
Mhm.
That's
It helps that if you get Multnomah, Clackamas, you get the urban counties there. Malheur County's population is so small that even if it's at 35%, it's really kind of insignificant in the total percentage. So
The current estimates are that the state will meet that metric within the week. We're moving at a weekly rate, which we should be able to meet that within this week, if not this week, next week.
And it's all the more incentive for us to keep doing really well so that we can pull the numbers up everywhere.
okay. Thank you, Darren.
Thank
Appreciate
you.
it. Next up on our work session agenda is commissioner meeting format and schedule with Jeff Hexel. Jeff?
Great, thank you. In the packet, I think there's some information about a proposed meeting schedule for July, August, and September, going back to the one meeting per month, and then if needed, then we'll have special meetings during those months. And then the other thing is the question about meeting format has to do with whether or not, perhaps starting in July, you want to go to in-person meetings. And so that's a question that I would throw out there. We do need to do some reconfiguration in this room to accommodate that, but I think we can get that done if you want to try to go to in-person meetings in July. So that's what this particular agenda item is about. And so I would welcome any feedback.
I'm sorry, maybe I missed something. Where is this in the packet? I just see a single page in the packet which just has parametrically talks about the number of meetings, but there's not a list of dates or anything in the packet, is there?
There was an agenda request form that I saw.
It is just the one page, Commissioner Babbitt.
yeah.
Oh, okay, so it's just a description that there'll be one a month during July, August, September.
And then the format question is about moving to in-person meetings and whether or not the county is ready to move forward with that and when.
It feels like we should be at that, at least to me, with our vaccination rates being up where they are. To me, it feels like it's time to probably move back into an in-person format. But I guess the bigger question to me is, that's one aspect of it, but are we going to continue providing the streaming for people who want to attend virtually? I could see there being a real value long-term in continuing to have this. We've had more people at our meetings. I think it's an easier way for people to attend and know what's happening. We have the technology. To me, it seems like we should probably continue providing that format for folks who want to attend virtually. But I don't know what everybody else thinks.
I've got a comment about our meeting room appears to have terrible airflow. From everything I've seen, we know the building is not exactly the most modern building, but the room has low ceilings and it's a relatively cramped space. And so Les, what I'm getting at is that I'm concerned that folks who are immunosuppressed, immunocompromised, might be uncomfortable coming to in-person meetings for quite some time. And your question about whether we should continue to have alternatives, because of the state of that room, I definitely feel that that's a well taken point. I'm actually a little nervous myself, even though I go into Rose Hours, I'm comfortable. I'm less comfortable thinking about going into that conference room than I am going into Rose Hours. So I definitely have mixed feelings given the state of that room, and wonder if there's things we can do to improve the airflow in that room if we're going to be meeting in that room.
Well, and also, are there interim? There are air filtration systems that you can get that are portable, that are not that expensive, that are HEPA filter, that will do a fairly large volume of air turnover in a fairly. I use one. I have one at FID that we run since COVID started. I bought a large industrial one, and I mean it turns the air over in a fairly short period of time. And it seems like for a room that size, that would be, they're only a few $100s. and then filters to replace on a schedule. That seems like a pretty logical thing to do no matter what, because we have flu season annually anyway. And so just from that standpoint, that seems like it could be a fairly inexpensive interim, helpful thing to do.
Jeff, what do you think?
I agree with moving back to in-person and supporting the 1 meeting per month model. The other entities the 2 other large meetings I have monthly have opted to wait until September to return to in-person meetings, but I'm personally comfortable returning to in-person. I do like the idea brought up by Les, and with the concern of Arthur with the airflow in the room might be something to address. So I'm open.
Jeff, any comments about the room and your suggestions?
Was that directed to me? I'm sorry. I couldn't-
Yeah, Jeff, we're talking about trying to set the room up, maybe putting some air filters in there.
I think that might be a great solution that would be easier to implement more quickly. I think one of the items that I'll put in the realm of the looking at our facilities and things that we need to do. One of the things I know that needs to be done probably in all the county facilities is that we really need to have our ductwork looked at and have it cleaned, and probably move forward with that at some time in the near future. So that's one thing, but that's going to take some time. And it could be when that is done, we look at some filtration systems as a part of that analysis. But that would take too long, and I think the more immediate solution would be one that Commissioner Perkins identified in terms of the air handling piece of it. In terms of what I'll refer to as sort of the hybrid model for the meetings, I think that's entirely doable. We do have the technology, it's available, and we have the systems in place to be able to do that now.
So Jeff,
I would think that
suggestion we
most
start on
places
the
are going to go
21st.
to a long-term hybrid where it's just become part of the norm where people have access remotely. It seems like what we should be moving to, just in terms of getting better participation and having people be better informed. So we were kind of forced into it, and seems like we should. I just got a notice that my internet is unstable, so tell me if I'm cutting out.
You're still good.
Okay, good. So yeah, it just seems like something that most organizations should be considering to keep. It allows you to. It seems like it would allow us to transition in the event of anything else that comes up. We have the ability to move to remote really quickly and easily, and it just gives better options.
Well, I like the idea of putting those air filters in there. I have trouble in that room even before the pandemic came. I don't know if you guys noticed, we had a few coughing attacks in there. I know it's like an allergy or something from mold or something in there. So we could probably put a couple of those filters in there. Jeff, are you looking at the 21st for starting in person, or you want to wait till July?
It would need to be the July meeting.
Okay.
That's
Okay.
21st meeting, but it would be the second Monday in July. Third Monday. Excuse me, third Monday. I'm sorry.
Third Monday. So Heidi, we're talking about doing this so that we can have a virtual part of these meetings too. Any comments from you, Heidi?
Chair, it's very doable. It won't really be any different than what I'm doing right now. I just won't invite panelists because y'all will be in the room with us. It'll be great.
Okay.
Thank you.
I'm sorry, Heidi, is it possible for panelists to not be in the room? So for example, if someone's on the road, will they be able to participate virtually as a panelist? I guess that'd also be a question for the chair. Do you think that's manageable to try to have a meeting with some of us not present?
If I can see you on the screen or have you on the screen like I am now, it doesn't really matter where you are. But as with anything, when we do a little bit of change, I got to figure it out because I'm not as techie as you are, Arthur.
I'm not going to
Yeah,
say.
I don't have a problem with it.
So
Okay.
from my standpoint, Commissioner Babbitt, yes, that would be fine too. If somebody needs to be absent, you know, or just can't physically get here, absolutely, no problem.
Okay, any other comments on these commissioner meetings and the room and how we're going to do the meetings and when we're going to do them? Nope, we're good.
I'm just kind of toying in my head as to whether we should have have it based on some community metric or something. And I'm just thinking out loud here, but I'm wondering if talking to the health department and asking them if there's some metric, maybe we've already met all the metrics possible, but it would be nice to have some target in mind, some threshold.
In terms of,
Vaccination rate in the community, something like that. Infection rate, vaccination rate. I'm not sure. I'm just thinking out loud, like I said.
I guess I was looking at the 70% is kind of, that was kind of, to me, that was that once we hit that 70%, that seemed like a good, if that's the statewide target that's allowing the governor to say, hey, we're going to lift all the restrictions, and we've already met that as a county. From my perspective, that was kind of my comfort level of going, okay, that's the target the governor set. We're there. Then in my mind, it's probably time to move back. But
yeah, I'm partly there, but the 70% of 18 and older is what that number is.
Right.
You know, most of the quote unquote experts say that that does not define herd immunity. That's based on something between 70 and 85% of the entire population, which is 0 and up instead of 18 and up, according to Dr. Fauci. Last night, I heard him say that again. And certainly as we get what they've seen in other countries, like Israel, is when they get above 70% of the total population, they've started to see a dramatic drop in transmission. And so I am really looking forward to when we get to that point. As I said, I think we're above 60%. We're just at 60% right now of the total population. So we're pretty close to that 70% of our total population. And we'll probably be there by July. So maybe that's what's going to happen.
That sounds like may even be at the state level for the 18 and over 70 by third week in June. Right things are going.
you mean
So by the
statewide?
end of July, it's going to be, pardon?
You're talking about statewide?
Yeah, statewide, yeah. And so I by the end of July, we should be pretty good, I would think, but I'm not the expert.
I guess the reason I bring it up is because my concern, I think we're going to be fine through the summer. The question mark in everybody's mind is what happens when fall hits again. And I hate to be in a position where we're backstepping and going to online meetings again and that sort of thing, with another surge this fall. I believe that we're getting to the vaccination rates in our county, at least, where that's unlikely, but I'm not, no one knows, right?
Yeah, I think we're in we're kind of in that funny place where, like you said, the experts are quoted, it's a pretty wide range, 70 to 85%. That's a pretty broad range. And so, yeah, how long do you wait? At what point do you step in and just say, okay, we're at a good point, and everybody's comfort level is different. So I think it's a good conversation to be having. I'm comfortable now. But I've been comfortable since I've been fully vaccinated. And I think part of still giving that platform where we can have participation remotely can give those who have a higher risk level or their comfort level is not there yet, the opportunity to still participate, but not have to be in the room. And I think that's important. I think that's an important piece of being comfortable with going back to in person.
I agree. Any other comments? Anything else, Jeff, on that topic?
Thank you.
Okay. So that finishes up our agenda on the work session. Next up, we're going to have a special business meeting. First, are there any additions or deletions to the agenda?
Mr. Chair, I had sent an email request to find out when on our schedule are we going to be talking about what's the plan for the plan on the ARPA money? Is that going to fit into the agenda in some way?
Yeah, I saw that about 10 minutes before I went into this meeting, so I didn't really have a chance to talk to Jeff about it. Jeff, any comments?
You know, I think for staff's purposes, we're in the process of doing some work as it relates to trying to forecast, in particular, what the public health need might be over time. We know that for the first couple of years, public health is likely to be taken care of, but we don't actually know just yet what that might look further out. So we have some work to do in that area. And then we are looking at the board's strategic plan, as well as the act, as well as the tiered priorities, and looking for ways for expenses that would be appropriate that meet all of those needs. Some of those are within the current year budget. Some of those are in out years, and trying to put together a list, so to speak, of what those things might be over time. I would say the one thing that I learned last Friday that I was unaware of, and maybe you are all aware of it, but I was not, is that I had been under the impression that this money had to be spent by the end of 2024. That's not the case. It's 2026. It has to be encumbered by December 31st of 2024, but it does not have to be expended until 2026. So the horizon is much different than what I had initially thought, and that does create some opportunity for the county in terms of use of this money over time.
Jeff, I think as I heard that comment on that phone call on Friday, that was to enable capital projects that were in process as of the end of 2024. I'm not sure, and I'm not sure they gave us any firm answer, or whether you could simply encumber it by saying, hey, our plan is to spend it to support this program in the health department in 2025.
Yeah, I would agree that we need to understand what they mean when they say encumbered, but there are various ways to encumber your expenses, and so that's something that we'll need to learn. But if that's an option, even if it's only for capital, that creates a different situation for us in terms of how we look at this money and how it's spent over time.
So I guess if there is to be some of this money that's going to be going to the more general businesses and not-for-profits in the community, it would be nice to be able to estimate how much we're going to need in some rough form, and to carve out a piece of that and disperse that sooner rather than later, like sometime this fall, instead of waiting too far down the road. So I guess that's why I'm asking about this. I know there's a lot of work you have to do to get this plan ready, but I'm wondering if there's some way to carve off some piece of it so that we can disperse stuff outside of the governmental arena more quickly, as people are really in need this fall.
I think that's entirely possible. I mean, the commissioners can do that realistically at any time you so choose. It's just a risk of not knowing necessarily what's going to happen in the future, and whether or not you hold money back to respond, or whether you get it out the door quicker. And I think you have the flexibility to do it how you think is best for Hood River County. I think you have that latitude. I think from staff's perspective, what we want to do is to give you the best information that we can, help you know what the county might need as it moves through time, and to the extent that it's possible, provide information to the commissioners in terms of what are the biggest community needs that we are aware of that don't already have some funding stream attached to them.
I would love to see.
I would suggest, Arthur, that since we don't have this on the agenda and we've kind of done a lot of conversation about it right now, that we wait until the meeting in 2 weeks and we'll put it on the agenda and we'll bring us up to date with whatever additional information we have at that time, and we can have a longer discussion on this. I think it would be more appropriate.
I appreciate that. Thank you.
Okay, first up, consent agenda.
Move we approve the consent agenda as presented.
I'll second.
Any discussion? Commissioner Joplin,
Yes.
Mr. Perkins,
Yes.
Mr. Babbitts.
Yes.
Chair votes yes. Anything else for the good of the order, Jeff?
Nope, that's it. Thank you.
Thank you, everyone. Have a good evening.
Thank you.
I got
Thank
50
you.
minutes till the next meeting.
Enjoy.
Thank you.
Bye.